Welcome to the Clinical Cookout. Hey now, it's your Auntie Ashley.
What's up? It's your girl, Auntie Shug.
Hey, it's your girl, Auntie Quiche.
Hey y'all, it's Auntie Amber.
This podcast is for educational purposes only. We are qualified clinicians who will cover various topics on mental health and will sometimes provide community resources. We are not being paid by any organization for our content, and any information we provide is general and pertains to our own personal experiences. We do not, I repeat, we do not provide psychotherapy, diagnoses, or treatment recommendations on air. Any concerns related to your individual mental health should be directed to your medical and mental health professionals. We are not responsible for others' decisions or the subsequent consequences.
Soundstripe.
Well, welcome back to the Clinical Cookout. It is part 3 of our sexual abuse series, where we will be talking a little bit about treatment, different types of treatment, EMDR, TFCBT, PE, CPP. I know you don't know what those mean, but you will learn through this episode what those mean. So just to start, Auntie Shug, Auntie Ashley, and Auntie Quiche all have experience working with clients with trauma. I do not. So I am going to, I don't know, maybe throw out a couple of scenarios and see how you guys would respond to certain situations. The first one would be a young child. So let's say you have a 9-year-old child that comes in for treatment. They have been sexually abused by a family member who is very close to them, but they don't want to disclose to you who that was. You start to do whatever type of treatment you feel is right for that child, but they absolutely resist. Like, they are not capable of processing the memories, of being aware of, their body clues. How do you approach that? How do you get over that hump with the child?
I'm leaving this one to Shug and Quiche because I would never have a 9-year-old. Go ahead.
I work a lot with children, and I know Quiche works a lot with children. So you're talking about a resistant child that's not even resistant to CBT, but resistant to therapy. Sometimes you get children, even adults, but you get children that come in and they don't want to talk about things. And I had a child say, therapy is weird because people expect you to come to a place you don't know and talk to somebody that you don't know about things that you don't want to talk about. And I was like, wow, like, so kids are super perceptive. So I didn't jump straight into just talking her to death or trying to talk therapy her to death. I play games. I will beat the snot out of a kid and connect for her. And I don't let them win either.
Mine is Uno. I be tearing them teenagers up.
Not out here not letting the kids win.
Nope, not letting no kids win. That's not life. But I would beat the snot out of a kid. And they like it. Because if you think about it, they play games and stuff for a living, really. And so I have one kid, he beats the snot out of me. He'll win like 9 times in a row. He plays online with family members. I'm like, you playing Connect Four like that? But like, it just helps like to build the rapport, because you want them to trust you. You want them to want to talk to you about stuff, and you want them to feel comfortable when they come in your office. So I tell them this office is a safe space, and if you don't believe me, just let me show you.
Mm-hmm. I would have to full-heartedly agree with Auntie Shug. Building the relationship with the child who is resistant to therapy is key. I mean, I think that's even with adult. And they say that, they teach us all throughout school that relationship building and that therapeutic alliance is important, and literally the hallmark of you starting your therapy journey. And it's the same way with children, using those different, ways to engage them. And that may be playing games, Connect Four, Uno. I do something called Jenga. So they love building the blocks. And typically for my Jenga, if I have an older, like an adolescent or a teenager, there's questions on my Jenga. Like I taped questions to it. And if a teenager and if the child is a mature, like the 9-year-old, if they want to answer those questions on the Jenga, that's also a way for me to kind of get to know them. So starting off with a game, something that's not too intrusive, and just building that safety net for them, I think is important of how you address some of the resistance. Now, if it's a child and they're like a child smaller, younger than 9, I will do play, and allow them to play freely without me saying, "What are you doing? What is that?" Nope. I mean, I may ask them questions, but I will freely let them play, um, and go from there. But it's the rapport building. Auntie Suge's definitely right.
Yeah.
Yeah,
Yeah,
and
I agree. The only experience I had was one 14-year-old client, but we did a lot of music therapy. Like I would
Hmm.
have her, I would say, play me some of your favorite stuff you listening to right now. And I would like play a game with her, like, I bet you think I don't know the song or the lyrics. And I would sing them all or rap them all, and it instantly connected me and her.
Hmm.
yeah. No, relationship is definitely important. I just want to touch on something Auntie Key said as far as play, right? So you learn a lot about how a kid is thinking about themselves, about their family, about other people in the world through play. And while I haven't done a lot of trauma work, I've worked with kids a lot and just watching them play. Like I had one kid who would play with their family, but the dad was, all the way across the room. They would take the dad doll and walk across the room and put the dad there while they played with the rest of the family. So what does that tell you, right? Dad is distant. Dad is in the home, but dad ain't really there. So that's what we need to work on. So you'll identify things like that when you're working with kids,
Hmm.
and just watching them play with certain things. So
Yep.
I do like that idea too. So what about adults? So if you have an adult who comes in, I don't know, let's say like 32, we're gonna go with a female, right? And she was abused as a child by a uncle, a man, and she has for her whole entire life had this thought that men are bad, so she stays away from men. Men are bad, and actually, it's to the point now where it's kind of delusional. Like all men are bad in the world, and she's kind of stuck in this loop. How do you treat that? How do you approach that?
I think it's a little bit similar. Like you always want to build the rapport first because people, even adults, don't come into therapy just trusting the therapist. They don't know you, so you have to do that rapport building. I know with me, I usually don't even get to stuff like that until like 5, 6, 7, sometimes 8 sessions in, because we will talk about everything else. We will go through everything else. We'll do a lot of other things. I like to teach mindfulness work so that we can like do grounding stuff in the beginning of sessions and at the end of sessions. So I take my time and I allow the client to bring that out like when they're ready, because if I just ask about it, they might not be ready to talk about it. I actually had a client tell me, look, I'm not going to be ready to talk about certain things for a while, so don't even bring it up. So I didn't. I was like, okay, when you're ready, it'll get brought up. So I kind of like gauge it with the client. When does it seem like they're connected to me? When does it seem like they trust me enough? When do they start to feel a little more comfortable with me to talk about those deeper things?
I let the client know immediately. Um, when they come in, kind of like we're not here because you need a new best friend, And I don't say it like that, but like, I'm not that cavalier, but we're eventually here to do some work. So we're going to do some rapport building and it's going to be nice. And, you're going to be comfortable, but eventually we got to be ready to get into the tough stuff. Cause, I want you to get better. You want to get better. And then I go client led. So I immediately put that out there that eventually we're going to get to some tough stuff. And if I push you a little bit, don't be upset. I'm going to be doing my job, and your job is to process through your trauma and to get through everything. And so that's worked so far for me to where they're like, I'm establishing the boundaries. Okay. We're not going shoe shopping, but we are at the same time going to be working through your stuff. And so I do have very, very good rapport with all of my clients. The one I didn't have good rapport with, it just wasn't there. And so from the jump, when I give out that disclaimer, you'll know if you're ready to start right then and there, or if you're just not ready at all. And maybe it's something that you need to come back, because the one thing I don't want to do is waste somebody's time and take their money.
I will say that if it's an adult who is have these thoughts, I would say again the rapport is important. Um, the report is important, obviously, but I also think that sometimes we think about what type of schema these this individual has created when it comes to men, like what category they've put men in and what type of experiences they've had with men. So I tend to try to meet clients where they are first. That may be starting with validation. That may be starting with, yeah, they may, all men aren't whatever. I may start with that just to give them, just to have them feel like, okay, somebody is seeing me and hearing me. And then we may go more into, okay, if a situation happens, then I'll slowly use those CBT type of things, like what's your evidence of this? Or I would may ask them, about the dichotomous thinking, the black and white thinking of, is it all or is it some? Or give me examples of a man treating you right. Well, a man that just gave you your food out the fast food place, did he say thank you? Did he say ma'am? Did he say those things to kind of give you evidence that maybe he doesn't, maybe he's not a shitty person? I don't know. But it's just like giving them small doses of there could be other things. Because sometimes people take their feelings as facts versus kind of walking through what is it called? Having evidence for those thoughts that they have. So I try to start off building that rapport, validating, and then walking them through some sort of cognitive restructuring of those thoughts, and addressing those schemas that they've already developed, and seeing how that worked out for them. Sometimes people don't want to change, and then you have to ask them, okay, well, how has that been treating you so far? And if it hasn't been treating them good, then what can we do to change that?
I love teaching cognitive distortions, Auntie Keish. I love it. That's one of my favorite things to teach clients.
Love cognitive distortions.
And reframing.
You know what? You ain't slick either. Because
What?
you did that to me during my dissertation.
I did too. Cuss me out about posting about cognitive distortion.
What did I say? What did I say, Shug?
Like, Shug, what evidence do you have that says that they all want you to fail?
I'm still waiting. I'm still waiting for the evidence.
Don't feel bad. She cussed me out too. I literally posted about cognitive distortions and I got cussed out.
Yeah, but people get so mad. They get so mad if you challenge their thoughts about something, their beliefs. So if you're not challenging it and you're kind of bringing them to it, they're more accepting. But if you just straight up say, like, there's literally no evidence for that, you tripping. People are going to be mad at that, and they're not going to respond to that. So.
And don't get me wrong. I think that also when you have clients that say those absolutes, sometimes you have to check your own self, and that's about being aware of your cognitive bias. Man, my bias is, sometimes men ain't shit. So it's very easy. It's very easy to go along with that with your client versus helping your client. It's not about what I think. It's about how to help this person in the crisis that they're in. So I also think that you have to be aware of your biases as well, because we're not perfect either. So, I think it's just important.
This is why I implement narrative work with a lot of clients. Like if I had a client who was thinking that way, of course I teach the cognitive distortions, but then the narrative work is tell me your story, and then can you see how you can create a new story? Do you understand you haven't met every man in the world? So you get to create new stories with other men and you build from there. So that kind of helps a lot of people too, being able to just tell their story.
Right. Yeah. And it's the same. I mean, yeah. And you can do the same thing when it comes to, have you met shitty women? Yes. And do you think that all women are shitty? No. Okay. Well, but that's like later on down once I build the report. You can't do that right off the bat.
Wait, she's over here whispering.
She ain't calling you no more.
She's calling you no more.
Wait, what?
She said she ain't calling you no more.
I mean, I know I be getting therapized. Well, I'm a patient.
You needed to be. Okay. All right, I got one more for y'all before we bring on our guest to talk specifically about treatment. Okay.
Thank you, bro.
Tighten up. Y'all ready?
Yes.
Okay. Tighten up. All right. You have a client that comes in there, young adult. I'm gonna go through all the stages of life. Young adult, 20, 21-ish. So they come in, they see you for therapy, they tell you the whole story of everything that happened to them, right? Including the person that abused them or sexually assaulted them as a child or as a teenager or whatever. But as you start to do some narrative therapy with them, they start to realize that, you know, this was the wrong person. The person that they thought did it wasn't the person that actually did it. It was someone else. How do you address that? Do you believe them? Like, what do you think?
First, listen, that's where that EMDR stuff come in. But the first thing I do is I have them process. You know, after rapport building and all that, like we kind of process and go through what happened when and I like to do timelines, because there's a good timeline will help somebody remember exactly when things transpired. And even if they can't remember exactly when things transpired, you can put them in order. And so I do a timeline, and then I do orders of what's the most traumatic for them. And then sometimes you might find out, well, this person wasn't in your life during this time. So, you know, was it this person? Or how do you know? Or like Keish says, what evidence do you have, or what do you remember? Because everything is going to be client led. So just going to them about like what they remember, how they remember it, and then just processing from there.
Yeah, I would say with that, if that is the scenario, there's a very strong, if not 100% possibility that now you're going to be dealing with a layer of guilt, which is another thing that you have to help them process, because now they're going to feel like, I did this timeline, I realized I got it wrong, but this other person got in trouble. So what now? Now they feel that guilt. And I mean, you can't help, a lot of times they say like what a survivor remembers could be skewed, or they could remember it wrong, but you got to try to make them understand even that is not necessarily your fault. You were traumatized, so that skewed your brain in that moment. So I would work on them processing the story as well as combating the guilt that's going to come with that revelation.
I would say, when it comes to that, I would always wonder why that person may have forgotten it. And I would provide psychoeducation as far as how the brain operates through a traumatic event. I think a lot of people who experience these things and then it comes up, they're like, what just happened? And sometimes explaining to them how the brain works and and how memories are stored in the brain is a very good way, like leading into it, you know, before we get to, you know, them feeling really guilty about it, kind of, you know, explaining to them how their body works and how their brain works. So I would say leading with psychoeducation on top of, you know, addressing any guilt if that's a part of it. And I love me a good trauma timeline. Like trauma timelines is dope. So Atisha bringing that up is very, very good, because then sometimes, and I have a whiteboard. Well, used to, I need to buy a new one. But when I use my whiteboard and did trauma timelines, like having people visually see something can be very life-changing for them. So they can see in front of them like, oh, okay, this happened. Like they can have a visual representation. So timelines and psychoeducation, definitely the way to go for me.
You know what, too? Unconditional positive regard. And unconditional positive regard is just, no matter what they come up with, you are just like, you know what? I regard you as a positive person, as a good person. There's nothing that you can say in here that's going to unnerve or disturb me. And no, I don't care if you found out today that it was somebody else that you thought it was. Even if I found out that you lied, I'm still here to help you through this process. And when people know that you have their back regardless, and that you're going to show unconditional positive regardless, it's probably a weight off of their shoulders. And just to let them know I can be free in here, and this is a safe space.
You get that.
Enough, you are worthy, you are deserving. Those are three things that a lot of people don't believe about themselves. So I reiterate that with every client. You're enough. You are enough. You are worthy. You are deserving. Reiterate that. Even with people in life, just reiterate that, because a lot of times we get in positions where we don't feel like that. Like, I don't deserve this. I'm not worthy of this. I'm not enough. Like, reiterate that to the people in your life. That positive regard is beneficial.
Yeah, and I was just gonna comment on something that Auntie Keisha and Auntie Ashley both touched on, which is like how your brain can confuse memories, or things just don't seem like, a lot of people don't understand how that happens. So in this situation where, you make this trauma timeline and this person realizes, oh, it wasn't that person, it was this person. People from the outside are going to look and be like, oh, she was lying. She was lying. She wasn't being truthful. See, this is how it happens. Women always do this, blah, blah, blah. When in actuality, there are gaps. Like, if you dissociate or if you kind of suppress things, there are gaps, and your brain has to try to fill in those gaps. You don't have any control over how your brain fills it in, right? So it fills it in with one person, and then when you actually write the timeline out, it's a different person, and you're like, oh shit, like, I can't believe that. So it really is interesting how our brain works. And I guess for other people, just being, having empathy and understanding that, like, if you are a family member or a friend of someone who has experienced a trauma, whether it's sexual or not, do your duty, do your due diligence, do some research, look it up, figure out, how the brain can work, how different things like that, so that you're not judging them or looking at them as a bad person if they, mess up some details or get some things fuzzled up there.
Or if they just lie.
Yeah.
I was just gonna say most.
I mean, people do lie.
Lying, but there are some that are.
Because you know what? If you get a teenager or something like that, they're skipping school, they're in the wrong place, wrong time, doing something that they know they shouldn't be doing. Sometimes they have to make up a story that fits their narrative because they're scared. They don't want to get in trouble. There's a lot of things that go into that. And so sometimes when people lie, there's always a reason why. There's always a why. Because
why.
Yeah. And just getting to that why. And then a lot of times too, even if I have adolescents later on, whenever they're comfortable, I do family sessions. I love family sessions because then I get the chance to see how the core beliefs started. I get to see how the parents are handling it. And I get to model how to speak with this person that's been through this trauma. And I've seen it be very, very successful. And those open lines of communication are everything. So even when they lie, even showing the parents how to show unconditional positive regard, because a parent, the first thing they do when the child lies, me included, I'm mad because I'm like, I hate the lie. Tell the truth. But just unpacking those layers of why people are lying helps the parents learn that, my child is in distress. That might be the reason why they're lying about this, because the sexual trauma or any other kind of trauma is something that you have to grow through. You just don't get over it. And some parents want you to just snap out of it, and it just does not work like that.
Yeah. A traumatized brain is an altered brain. It is not the brain that they had before the trauma. It is literally altered.
Yep. But the good thing about brains is that there's something called neuroplasticity. And so brains are able to be altered to go back. So just like they've been altered the first time, they're also can be trained to heal. I
see you studying that EPPP material. Look at you. You studying. You studying. Okay. All right. Well, that was fun, actually. Throwing out those scenarios. Y'all had some good answers. So I'm pretty sure y'all are well equipped to deal with trauma. I'm not trained in it, so I don't tend to, go too deep with that. I kind of refer them to someone who can provide the better service for them. So we're going to go ahead and shift into talking about treatment. We do have a special guest on today, which is a good friend of mine. Her name is Stephanie. So I'm going to go ahead and pull her in and let her introduce herself. Hey, Stephanie.
Hi, I'm Stephanie. Hey. Let's see. So I'm a clinical social worker. I've been doing that for about 12 years now, and I've been a therapist since 2017. I grew up in Texas. That's where I reside currently, and that's where I practice. I work in therapy where I help people with anxiety and depression, trauma, mood disorders, and I specialize in EMDR and DBT or dialectical behavioral therapy.
Wow.
Welcome.
Nice.
Yeah, welcome.
Thank you. Glad to be here.
So of course we're talking about treatment in this episode, and that's one of the things that some of us aren't really well versed in when it comes to treatment for trauma, specifically for sexual abuse. So you mentioned that you are certified or becoming certified in EMDR. Can you talk a little bit about what that is and what it's used for?
Yes. So EMDR is a type of therapy was created by Francine Shapiro. And basically, the concept is that when something traumatic happens to us, it gets frozen in our system with the pictures and the memories, the feelings attached to that incident. And so, anytime we get triggered, we're kind of taken back to that traumatic event that happened. So, with EMDR, we use bilateral stimulation most often, but there are other ways that you can do it. Um, and so you mimic the eye movements of when you're sleeping, and so basically you're able to take that traumatic memory and process it along the what they call the neural pathways to a more less activated memory. So where something used to be really triggering, it no longer is triggering after you process it with EMDR therapy.
I know sometimes EMDR can be tough because some people like it's so intense that some people will just choose not to do it. Just because even during EMDR,
Yeah.
because obviously it's not one treatment, but it brings up those tough memories. So now you might not have had dreams, but traumatic dreams, but now you're talking about them constantly because you're doing the
Mhm.
EMDR, and I think it makes it pretty
Mhm.
tough for some people.
It does. So what I tell people about EMDR is it's the high intensity interval training of therapy, right? So you can get to your goals of healing through a lot of different ways. EMDR reaches to a place that talk therapy sometimes can't get. So yes, but it is, and if you're as a therapist not intuitive and aware of where your patient is, then you can overwhelm them with with the therapy. And so there is preparation that has to be done for EMDR to make sure that a person doesn't easily disassociate. And if they, I start I start with people doing a few rounds of talk therapy first to kind of gauge their distress tolerance.
Mhm.
Typically, I do not just go straight into EMDR with people. And so to gauge their distress tolerance and how they can manage that stress. And then if you get into the processing and they're overstimulated or they're out of their window of tolerance, then you have to pause and bring them back into that window of tolerance. So, but no, it is an intense therapy, but it does work faster and I think more thoroughly than most talk therapy. Basically, once I've done enough talk therapy, sometimes you hit this wall, like the person doesn't have any more to give as far as talking goes. And so that's when we bring in EMDR to see if we can process some things that are stuck from childhood on, because we keep having those traumatic things in our lives past childhood.
Mhm.
I have a question for you, Stephanie, because the last group practice that I worked for, we my supervisor at the time got us this training. She paid for it, which was cool, for what's called flash technique, and they call
Mm-hmm.
that the precursor to EMDR. So a lot of times with clients, we were told do the flash technique, and if you come to a stopping point, they are a good candidate for EMDR. So I was just wondering if you had ever heard of the flash technique, or is that something that you yourself like did prior to doing EMDR?
So I haven't heard of it before. Can you tell me a little bit about it?
Sure. So basically it was a 3 week, not three like consecutive weeks, but it was like long weekends. We had to do it every Friday, Saturday, and Sunday for like 3 weeks. Um, and it's considered a precursor to EMDR because it works with eye movement. So
Mm-hmm.
basically, you tell someone what's a triggering memory that you have, and then you rate the distress tolerance scale, like from 1 to 10, from 0 to 10. And if they say they're at a 9, you do the flash technique. You're basically counting like 1, 2, 3, 4, and then they blink. They can do a single blink or a triple blink. And then after you go through so many rounds of it, you check the distress tolerance scale. And usually the number actually does come down. I know when we did it, we had to do it ourselves, like in pairings. Um, and I use my experience with Hurricane Katrina, which anytime hurricane season comes, I kind of get really antsy and it triggers me. So I did it. And like now when hurricane
Mhm.
season comes, it's not as bad.
Mhm.
It doesn't make sense that making your eyes move a certain way would reduce your responses to certain triggers. Like, I don't know. I was wondering what the mechanism behind that was. Like, what is it doing to help with that? It just sounds kind of weird to me.
So, with EMDR, they think that it's similar to REM sleep.
Hmm.
And so the idea is that we naturally process all of these things when we're sleeping, and that we can kind of mimic that in real life and finish processing something that got stuck after a traumatic experience. But the exact science is not really clear. It's it is kind of weird how it works, and
Mhm.
a lot of therapists, you know, think it's magic because it does work so well, and we don't really know how it works that well, but it does.
You get some therapists that just do not believe in it at all. They like it's poppycock. It's foolishness. It doesn't work at all. And I
Mhm.
mean, I had a coworker that did it, and her patients are doing well. So
I mean, it's kind of like hypnosis, right? Like a lot of people, a lot of therapists don't believe in that, but apparently research has shown that it can be effective with dealing with certain traumas or other types of experiences. So there's
I
always going to be like a group of people that are cool with it and a group of people that are against it and critiquing it.
I did hypnotherapy before, like as a patient.
Really?
Yep.
What was that like?
It was actually really cool, and I went into it very skeptical, even though like I'm into stuff like that, like different ways of different treatments that are like alternative style treatments that everybody may not agree with. But it was actually really, really cool, and it actually helped me a lot.
Nice.
Stephanie, one of my questions is, what made you choose EMDR versus other therapy? For instance, I've done a lot of TFCBT, CPP. I'm currently learning CPP, and which TFCBT, for those who don't know, is trauma focused cognitive behavior therapy, and CPP is child parent psychotherapy. And also, I've been trained in prolonged exposure therapy. So, what is, I guess, your reasoning for choosing EMDR over those other therapies?
For me personally, I read the book The Body Keeps the Score, and
Yeah,
learning about the way that our brain stores things and how we
correct.
have like a physical response to trauma.
Mhm.
Um, that's kind of what led me to EMDR, was reading that book and how successful that it was for those patients. I do think that TFT therapy are also important because everyone is not comfortable with EMDR. Everyone cannot rate EMDR, and so you need all those different things. And and some people don't like doing EMDR therapy. For me, it's natural. Like for me, I really prefer to do EMDR than talk therapy these days. But
Okay.
so that's what kind of led me to that one specifically, is just how quickly effective it is, especially for people maybe who aren't responding well to other types of talk therapy.
Okay. Thank you. I appreciate you answering that.
Hmm.
um I have a question. Do you do that? Do you have a chance to do MDR with children?
Yes, I do it with children, and they respond well. Also, you can do it with children as young as like 4 years old, and so you can do it with really young children. Right now, the child that I'm working with is like, she's around like 10, and she's responding not so much to the eye movements, but with her, we do tapping instead. And so we've been doing that for her anxiety, and she has noticed changes as far as sleeping better at night, um, feeling less anxious, and her mom like reports that her mood is better. So it can work for all ages, really.
my one of my old supervisors, he taught me tapping and then like the left and the right. He was a neuropsychologist, so like he would kind of go over that, but I was like, I'm always scared to do it because I'm like, nope, 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 I'm not certified in it, but I know that even doing it sometimes, like when I get nervous, it's super helpful.
Yeah. Yeah, there's the thing. It's like the bilateral stimulation is calming for whatever reason to our system. And so when you do the tapping in EMDR, if you're doing like positive tapping, you do it here, and then if you're processing, you tap on your legs. And so that's like a differentiation. Like positive emotions, you'll do like the butterfly hug, and then stressful emotions, you'll like tap on your legs.
Yeah. I have a question, Stephanie. Since we're like, this is of course, the third part to our sexual abuse series. So I was wondering, do you think EMDR is one of the more effective treatments for people who have experienced sexual trauma or sexual abuse, whether child or adult?
I think it depends on the person and also like how is it presenting. If someone is presenting with PTSD and having really strong emotional reactions to their triggers and like it's keeping them from driving or working or other things that they have to do, then EMDR would be a quicker way to start resolving those issues. But again, it depends on the person. I have worked with quite a few survivors of sexual trauma and abuse, and it has been helpful. And but also some of what we were talking about earlier, it can be overwhelming. So even when you're processing a really tough memory, it can take several sessions, and so that can bring up, nightmares and other things that the person while their brain is still processing. So depending on the person, but yeah, it can be really helpful and effective to desensitize those memories and those emotional responses that they're getting triggered in the world today. And so yeah.
Wow. It seems like EMDR is almost, it kind of reminds me of exposure therapy. You're exposing this person to their memories again. So it's kind of forcing them to confront it and process it.
Was how do you like bring someone down like after you've like brought the memories back and like try to help them process it and they're extremely triggered or overwhelmed, how do you bring them down so that they can leave the office and go back and function in the world with other people that day?
That's a good question.
We have a lot of different types of techniques. Some people will get out of that window of tolerance during processing. And so in that case, we will use grounding techniques. Some therapists use essential oils. There's all kinds of different techniques that you can use to get a patient grounded again, um, to continue the processing. And then after the processing, we've already done that preparation work I talked about earlier. So we'll do some meditation, some guided meditation, or go to what's called the safe calm place, which we've already created prior to starting EMDR. And so this is a imaginary place that the patient has constructed in their mind that's peaceful.
So out of the treatments that we've kind of introduced, which is EMDR, Auntie Keish introduced trauma focused CBT, prolonged exposure therapy, and CPP. I mean, out of those, which one do you all, and this is a question for all of us, but which one is like the most common treatment that you'll see for people who have experienced sexual trauma or sexual abuse?
I use trauma focused CBT a lot. Just because I like not to necessarily expose, but I like to a little bit of exposure, bring them back to that space, and then kind of give them like techniques to where like and it's similar to EMDR, like where where their body is reacting. I kind of give them tools to bring their response down, and then at the same time we're processing the trauma, and then so over time it just becomes less of a hard hitter as they're talking about it more. So me and trauma focused CBT are really good friends.
Yep, I would agree with the TFCBT. CPP is more domestic violence, along that line. And I would say probably PE as well, prolonged exposure. is another good one I think would be good. So between TFCBT and prolonged exposure.
Yeah, I agree with prolonged exposure, and I do incorporate flash a lot because it's less distressing than EMDR. So if for a lot of clients who said EMDR was too much for them, they
Yeah.
can revert back and start with the flash. So I kind of use that a lot, and it incorporates tapping. She made me remember that as she was talking. Flash technique incorporates tapping quite a bit.
Even with I do like the tapping. I seen people do the butterfly taps and stuff like that, and I usually do the bilateral just because I know, like, I felt it and I know that it works for me. But just like exposing them and then kind of bringing them back a little bit and just teaching them how to calm down, because some people I've noticed get really really tense. I've seen people, their heart start racing, they started sweating. um like one time I had a patient where I had to like expose her to like a baby crying and then kind of help her with her distress tolerance. So engaging her nervous system, making sure that she knew that, okay, that's not a real baby and it's okay right now. And so just like kind of bringing her down in the moment and letting her know, like, it's not real. It's just, it's your brain tricking you basically. And then how do you calm yourself down during that time? And it worked. Like, I think it took us about 2 or 3 sessions of just doing that because it was so traumatic. But she did do really well with that.
Yeah.
So that was TFCBT, trauma focus.
Yeah. TFCBT is like, to me, a very like top notch, only because when working with children, it's an opportunity for parents to be involved and for parents to learn different type of interventions that can be a support to the child. In addition to that, TFCBT doesn't always have to use every single step. You can use certain steps out of it that are pertinent to the situation. And so I think I like the flexibility of it and
Mhm.
the component of having um, parents or caregivers a part of it to help the client or help the child.
Yeah, because in vivo is the one I was talking about where you actually
Hmm.
expose somebody directly. That's the last step. That's usually after somebody is like able to tolerate everything else. So you're right,
Hmm.
Keish.
I do have a quick question for Stephanie. And I'm not sure if you would actually have the answer to this, but you have been trained in EMDR, so you may know just based off research. But have they discovered any like long-term negative effects to EMDR or any long-term effects in general?
That's a good question.
So not that I'm aware of, just some short-term effects like eyes being sore or bad dreams. But I have heard from other therapists, if they don't properly prepare the patient, that opening up those traumas without properly closing them back could negatively affect a person. And they may need to seek therapy or therapist if they just suddenly stopped EMDR after maybe starting to process a really huge memory.
Yeah, and I'm also wondering if there are any like cultural factors that impact the treatment as well. Like not just ethnic, but one of the thoughts is like LGBTQ youth or adults, if there's any differences that you've seen in treatment between them or between different ethnic groups, like any cultural differences.
Or even between men and women?
Do you mean
Yeah.
Or
specifically
older
for
gentlemen.
EMDR?
Yeah.
Yeah, and for trauma treatment in general, I guess.
Definitely culture and what that looks like for everybody is going to have to be taken into account with any type of interaction and therapy for sure. As far as differences go, for me personally, it looks like asking the patient what this means for them and what they need as far as therapy goes. And differences, of course, between a geriatric client and a child, or between someone who doesn't speak English. I work with also Spanish speaking patients. Um, and so there you always have to address differences, but there's not really anything I do differently in the actual therapy. just make sure that they're comfortable with what we're doing and how we're proceeding, and that the main thing is to make sure you have your rapport built really well at the beginning. So I spend a lot of time on that, making sure that we are a good fit, right? Because we're not always a good fit, and I think that's important for people to know. I think with LGBTQ patients, I just obviously, if I have a non-binary patient, then I have to be really careful about I'm using the right pronouns, and I don't want to offend anybody, right? So um, that is one thing that you have to be sure of. But I don't change my therapy per se. Maybe just like what we connect on. As far as different people, we're going to connect on different things.
Okay.
Can EMDR be done? Well, is EMDR only done in person, or is there a way to do it telehealth wise?
I only do it virtually. So
Oh,
there's
okay.
a tool that you use online. hmm Yeah, I use a
Hmm.
tool like a tool, and then you can use tapping also virtually.
Okay, that's good to know because I've always thought it was a therapy that you had to do in person because of the depth and what you had to do. So that's good to know. I did not know that.
Yeah.
Yeah, I have one more question for Stephanie before you go. So my question is for, I know you touched on this a little bit earlier about how you identify patients that may be good for EMDR. But for someone who has
hmm
experienced trauma, specifically sexual trauma, how would they know that this would be a
hmm
treatment that they want to seek out? Like what I guess personality traits or characteristics would indicate that they would respond well to that type of treatment?
So if you ask the guy that trained me, he will tell you anybody will benefit from EMDR. So I don't know that there's like a particular personality trait per se. I think it just is more the readiness for that type of therapy. So if someone is having really bad flashbacks or really bad emotional reactions to their trauma, nightmares, PTSD symptoms, basically, then EMDR is a way to get relief quicker than traditional talk therapy. But I think that it could be beneficial for anyone, just depending on how they respond. But again, any memory, even if it's not like a big T trauma, if it's a small T trauma, if your friend pushed you down on the playground and everyone laughed at you and pointed at you, we work on these types of things in EMDR also. So, it really could be beneficial for anyone, just depending on the person and the timing of their life. You know.
Sorry.
Goofy. Don't pay her
What are
any
you
attention.
It's
laughing
okay.
at? Did I miss something?
You talking about we work on it even if your friend pushed you down on the playground and laughed at you. And I had an EMDR thought. I just
Yes.
put that in my head. I'm sorry.
That's not funny.
It's okay.
It should not be, but this is what we have
I
to
know what
do.
she
What?
was laughing at. I know what she was laughing at. It
People
was the
go to
visual. It was
EMDR
the
because of
visual
you,
of
should.
the like.
They-
Oh
I
my
know I
god.
placed a few in EMDR.
Shook. Oh my God.
Well, we
Yeah.
really appreciate you coming on here, Stephanie, and talking about that. I think that was one EMDR that we didn't know a whole lot about.
Mhm.
Um, so we really appreciate you being here and sharing that. Do you have any final thoughts for the episode before you go?
No, I mean, I was gonna talk about like the reason why something like the playground would be important is because our core memories, like our core values that we talk about in CBT and other therapies, our core values are created through those experiences. So
Mm.
if your mom is always telling you you look fat or you look ugly or your dad abandoned you or whatever the case may be, your friend told you, I don't know, whatever, something silly like your glasses are ugly. All of these things forming those core values and beliefs at a young age. And we're working on those core beliefs of I'm unworthy, I'm stupid, I'm not valued, I'm not safe, I'm in danger. And so I wanted to tie that back that those we're working on those core beliefs and those core values just as much as we're working on the specific memories, because they're all tied together in our system. Basically, if we can process those memories and clear out the negative emotions charged with the memories, then we can also untangle those negative, really strongly held core beliefs that we have as people. So that's another way that we can kind of tie that in with CBT, because we work a lot on those core beliefs and those core values in CBT, and we work on those too in EMDR.
All right. So we hope that you guys enjoyed listening to us talk about trauma and the treatments. So now let's get into our foil, things that we want you to take away from what we just talked about. I'll go first. Since we had already started talking, I would say with trauma, if you have family members who you know have been traumatized, and I mean, trauma, like Stephanie said, could be big T or little t, from being pushed on the playground. I mean, I laughed about that, but not necessarily about the scenario, but just about, like, you know, those little T traumas, and you think back to childhood, it can be traumatic for somebody, even in adulthood, because it could create the schema of everybody laughs at me, or I've always been bullied. So just being sensitive to those kind of topics that somebody is trying to grow through and trying to process is like paramount. Family members, sometimes we don't want to hear about their trauma, or sometimes we get listeners fatigue, where we just like, I'm tired of talking about it. I'm tired of hearing about the same thing. But just allowing them to process is sometimes allowing them to get their power back by telling their story.
So I think my takeaway for everybody is understanding how trauma actually does impact you. Stephanie mentioned The Body Keeps the Score, which is a really good book that I highly suggest to any and everybody. But basically understanding how trauma actually manifests. Like if you are dealing with a lot of headaches, or you're extremely tired all the time, or if you're a woman and you're having issues with your menstrual period and it's out of whack, like these are actually signs, physical signs, that you may be dealing with trauma that you have not processed. So just kind of paying attention to your body, listening to your body. Do you get anxious? Do you have panic attacks or anxiety attacks? Like listen to those things, because it's not always just a normal thing. Sometimes it is because of the trauma you've experienced that you just suppressed. So once you process it, sometimes those symptoms ease up, and you can learn how to manage it better. So I just want people to know, with trauma, it's not just telling the traumatic story. It is how it also impacts you because you haven't opened up about it.
So I would encourage you guys to do treatment through telehealth if that's available. I did not know that EMDR was offered through telehealth, so I think it's important to take a chance and get the treatment you need, even if it's not the traditional way. So go ahead and book it through telehealth.
Well, for me, of course, I always got to bring it back to the kids, right? But it's really I know that sometimes when kids talk about it, you know, parents are in denial, or they don't really want to recognize or acknowledge what has happened. But your kids need treatment, right? If your kid comes to you with any type of trauma, they need treatment. They need someone professional who is going to help them process what has happened, help them understand what has happened, become aware of their bodies and their signs, and be able to develop healthy coping skills. So if your child comes to you and says something traumatic happened, even if you don't think it's traumatic, for your child, it could have been traumatic, or it could have been something that really impacts their functioning in different ways. Go ahead and seek help. Get them therapy. It couldn't hurt. You know, they might go and be able to function okay and not need therapy for a while, or they might go and need it for a while so that they can function. So that would be my takeaway for today.
So thanks for watching. We know that this episode may have had some triggering points. We understand that people go through things, and some of the people may have gone through some of the things that we discussed in this episode. So we just want to encourage everybody, if you see something, say something. And that's very powerful, because children can't advocate for themselves, so somebody has to advocate for them. Thank you for watching, And at the end of this, once again, we're going to put out our resources.
Soundstripe.